Welcome back to another video, and today we're going to talk about ancient medical practices. We're going to start on the continent of Africa, then we're going to travel to China, India, and then ancient North America. And we're going to discuss just how old medicine dates back to and what these different civilizations were actually doing and how they practiced medicine. We're going to start in ancient Kemet, known as modern-day Egypt. But before we go there, let's talk about Hippocrates. Hippocrates was a Greek physician. He was born on the Aegean island of Kos in 460 BC. He is credited as being the father of medicine. The Hippocratic Oath was actually named after him. It was believed that he originally wrote the oath, but then later discovered that it was written after his death. He died in 370 BC at about the age of 90. Now, what is not so well known is that Hippocrates actually spent 7 years in Kemet studying medicine. From there, he traveled out to different countries practicing before heading back to his home of Greece, where he really honed his, skills and became famous as a physician. But it's kind of impossible to be the father of medicine when the whole concept of your practice you learned from another civilization, Kemet. Not only did you learn it, but they were practicing medicine, a good maybe 3,000 years before you were born. So let's go to some documentation here. Now, the KNH Center for Biomedical Egyptology at the University of Manchester studied a medical papyri from ancient Egypt. This papyrus was written somewhere between 1650 BC to 1550 BC, which puts it around 1500 years before Hippocrates was even born. Now, the scientists who studied this papyrus found that Egyptians were practicing pharmacy and medicine long before the Greeks discovered the art of medicine. The scientists at the University of Manchester compared ancient remedies with modern-day pharmaceuticals and found prescriptions in the ancient papyrus and compared those prescriptions to pharmaceutical preparations of today. And they realized that those ancient prescriptions actually had therapeutic effects, which I'm not sure why, because ancient Kemet was pretty advanced. So it's no surprise that their medical pharmaceuticals would actually be effective. Now, this medical papyrus was discovered in 1862 by Edwin Smith. The papyrus is called the Edwin Smith Papyrus, named after the antique dealer when he purchased it in 1862. Now, the papyrus was written in Cometian hieroglyphics and details surgical procedures, 50 types of wounds and tumors. It described ailments by categorizing their severity. It also contained detailed anatomical descriptions and treatment processes like bandaging, suturing, and treatment for infection. The papyrus is the oldest known surgical treatise on trauma, and it may be known to ancient surgeons as the secret book of the physician. The papyrus showed that Egyptian physicians used honey to treat wounds and used resins and metals as antimicrobials. There were prescriptions for laxatives of castor oil and colocynth. They used bulk laxatives of figs and bran. Also, cumin and coriander were used as intestinal carminatives, and colic was treated with hyoscyamus, which is still used today. Aloe was used to soothe and heal skin conditions, and acacia was used in cough remedies. Again, both of those are still used today. As a matter of fact, I'm sure many of us have used aloe, for scalp treatments, skin treatments, a burn, a cut. So a lot of these treatments they used back then are used even up to today by us. Now, they also used celery and saffron for rheumatism and treated musculoskeletal disorders with rubefacient to stimulate blood flow and poultices to warm and soothe. Pomegranates were used to get rid of tapeworms, which remain as a clinical treatment until about 50 years ago. Many of the ancient treatments and remedies were used well into the 20th century. Now, one thing about ancient civilizations, Egypt and all of the others, is that their medicines came from the actual plants and herbs, whereas today's pharmaceuticals are produced synthetically. The most well-known Egyptian physician was Imhotep, who is from the third dynasty of Old Kemet. And the pharaoh Djoser reigned during this time period. Djoser actually reigned from 2650 BC to 2575 BC. Imhotep is considered to be a genius. He was a physician, an astronomer, a politician, and an architect. He is actually the designer of Kemet's first pyramids. It is also speculated that he is possibly the writer of the ancient papyrus that was discovered in 1862. While Hippocrates is credited as being the father of medicine, Imhotep lived 2,000 years before him, and he was already very advanced in his medical practices, which was then handed down from generation to generation in ancient Kemet before Hippocrates did his 7-year stint studying in Egypt. As a matter of fact, Imhotep is so well recognized for his medical practices and his knowledge that he was honored in Greece as well as in Rome. He is actually on the walls of Claudius and Tiberius. The medical knowledge of the physicians from this ancient civilization was so sought out and they were so well known that people from other countries like Assyria or Rome would call on a physician from ancient Kemet or Egypt when they were in need, or they would travel there for their medical treatment. So this was literally a medical hub for this part of the world at this time period. It is noted or speculated by the scientists who were studying the papyrus that the colonization of Kemet by Greece, who then renamed Kemet Egypt, later on is believed to have played a role in the Greeks crediting Hippocrates for the discovery of medicine as opposed to its original origins and concepts which came from ancient Kemet. Now, ancient Kemet is not the only place known for its medicine. While medicine does date back to over 3,000 years and Kemet is believed to be its origin, we have to look at some of the other civilizations. Like China, for example. Traditional Chinese medicine, which includes acupuncture and herbal remedies, dates back to about 2,200 years old. And the earliest written records of traditional Chinese medicine is the Huang Dai Neijing, translated to the Yellow Emperor's Inner Classic, which comes from the 3rd century BC. Now, in traditional Chinese medicine, the concept of yin and yang is the basis. and restoring and maintaining balance between the two forces is the goal. Also, understanding chi, or your life force, is essential. Chi, the energy network, connects your organs, tissues, veins, nerves, cells, atoms, and consciousness. Now, in 1596, Li Shizhen published Ben Kao Gang Mu, which is known as the Compendium of Materia Medica, which lists 1,892 substances and 11,000 formal prescriptions for specific ailments. And any array of these prescriptions and substances could be used to treat whichever ailment was present at the time. Now, like the ancient Egyptians, the Chinese were very advanced in their medical concepts of the body and treatments. All of this long before Hippocrates was born. Now, while Chinese traditional medicine has a 2,200-year history, Chinese medicine as a whole has about a 3,000-year history, and it can be traced all of the way back to the Yin and Shang dynasties. Back during that time period, there were more than 20 disease types that had been recorded in the oracle inscriptions of the Yin dynasty. The Yin dynasty dates from 1600 BC to 1046 BC. And according to the rites of Zhou, doctors in the Zhou dynasty were divided into 4 categories. Those were your physicians, your surgeons, your dietitians, and your veterinarians. Now, between the periods of 771 BC and 476 BC, medicine and witchcraft were separated, and the theory of yin and yang and the 5 elements began to form. Traditional Chinese medicine is still utilized heavily today, and parts of it, like acupuncture, for example, has been incorporated into Western medicine, and a lot of what they used then still stands. The concept of yin and yang and qi is still practiced and used heavily, not just in China, but elsewhere in the world. Now, as you move away from China and you head into India, they were using Ayurvedic medicine. That is a traditional Indian medicine which uses a range of treatments like massage, acupuncture, which was used in ancient Chinese medicine, along with yoga and herbal medicine, which herbal medicines are common throughout the world, from China to Africa to South America among the native tribes, North America among the native tribes. So herbal medicines are common all over the world. Now, in Ayurvedic medicine, they used all of these combinations for total health and well-being. And it is heavily practiced today in India and Nepal by about 80% of the population. Now, Ayurvedic medicine originated more than 3,000 years ago. The word Ayur means life, and Veda means science or knowledge. That translates to knowledge of life. Now, this translation of the word was translated from Sanskrit. And because Ayurvedic medicine predates written record, its practices were passed down orally from master to student. Now, the quote-unquote original text of Ayurvedic medicine is thought to be the Charaka Samhita and the Sushruta Samhita. It is believed that both of these texts date back to about the 11th century BC. Now, the Ashtangi Hridaya is another important text. And now, together with all 3 of those texts, they are called the Brahmacharya or Great Triad Trilogy. Now, I may have messed up that word, so hopefully that doesn't offend anyone, but I tried my best. Now, these three texts, the Great Triad or Great Trilogy, are the basis that modern day Ayurvedic texts derive from. Now, in Ayurvedics, they have a classification system of patients that is done by body types, and that is known as the Prakriti. And this is determined by bodily energies or doshas. And the three doshas are linked to the elements and controls certain parts of the body and the person's personality. Basically, it is believed that illness and disease is due to an imbalance of the doshas. So treatment is about rebalancing the three doshas. Now, this can be done by massage, meditation, a change of diet, herbal medicines, and other options which are listed among the text. And now you don't necessarily have to use all of them together. It is basically a combination of any of these. It could be one or two together, or three or four together. But you would take the medical practitioner would take a combination of these, and they would prescribe that to the person based on their illness. As you can see, traditional Chinese medicine and ancient Indian medicine, Ayurvedics, both revolve around restoring balance to the body in order to heal whatever illness you have. Well, not just restoring balance to the body physically, but you as a whole. So there are a lot of similarities there, and some similarities in what they utilize as treatments. But that's not the only civilization whose medical practices date back very far. When we travel here to the North American continent, the Native American medical treatments date to at least 12,000 years ago, and some maybe as far back as 40,000 years ago. And their medicine is based widely on the beliefs of healthy living, spiritual principles that restore balance, and the repercussions of disease-producing behavior. So again, this concept of total body balance to maintain health or to treat an illness, to get back that balance, can be found all over the world. Now, all Native American tribes hold the beliefs of this balance and healthy living and the repercussions of disease-producing behavior. They all hold those beliefs, but their methods of diagnosis and treatment may vary. Now, Native Americans have contributed to modern medicine in many ways from their ancient practices. We're going to talk about a few of those because I find them interesting. I think you will too. And we're going to start with something that we all will recognize all over the world. Now, Native Americans believed in using willow bark. So whenever they had a pain, they would chew on willow bark to relieve that pain. Now, that's significant because willow bark contains a chemical called salicin. And when that particular chemical salicin is broken down, it breaks down into salicylic acid, which is the main compound in aspirin. So modern day medicine developed aspirin off of the discovery that Native Americans used willow bark for their treatment of pain. Here are some other things that Native American medicine contributed. In 1853, a Scottish doctor named Alexander Wood was credited for the creation of the first hypodermic syringe. However, the Native Americans had created a method that used a sharpened, hollowed out bird bone connected to an animal bladder that could hold and inject fluids into the body. This was their earliest form of a syringe, and they would use it for anything to inject medicine, to irrigate wounds, to clean ears, and to serve as enemas as well. Another interesting find is that ancient Native Americans used plant-based practices for contraceptives. So they used the herb dogbane or stone seed as oral contraceptives. Now, oral birth control in the United States was introduced in the 1960s, and they were utilizing these plants for well past 2 centuries earlier than Western pharmaceuticals. Something else, sunscreen. Ancient Native Americans had a common skin application that they would use where they would mix ground plants with water to protect their skin from the sun. Also, they used sunflower oil, wallflower oil, and sap from aloe plants to protect their skin from the sun as well. Native Americans actually, what they have found is that there are more than 2,500 plant species that they utilized for different medical purposes. Native Americans were also utilizing their own version of baby bottles. The Iroquois, Seneca, and others utilized the insides of a bear and a bird's quill. Now they would clean it, dry it, and oil the bear intestines, and they hollowed out the quill, and it would be attached as a teat, allowing concoctions of pounded nuts, meat, and water to be drank by the infant for nutrition. They also had mouthwash and oral hygiene. Now, various tribes used various plants and methods for cleaning their teeth, but they utilized mouthwash that was made from a plant called gold thread to clean out their mouth. It was also used by many Native American cultures as a pain relief for infants who were teething. They also used it for tooth infections by rubbing it directly onto the gums. And I have one last thing, and that is that they utilize suppositories for pain and discomfort from hemorrhoids. Now, what they would do is they would take parts of the dogwood tree, and small plugs were made by moistening, compressing, and then inserting the dogwood in order to treat the hemorrhoids. As a matter of fact, dogwood is still used today externally for wounds. Although it's not used as often, it is still used today to treat external wounds. As you can see, many civilizations around the world were practicing medicine thousands of years before the ancient Greeks even learned about it. And a lot of the civilizations had one common factor, and that is that the entire you had to be treated. Your entire system, your entire being needed to be in balance in order for you to be healthy. The various different herbs and medicinals that they created were based on the plants, trees, and herbs available in that region, but their medicine for the most part all had the same concept. And I find that interesting, being how far apart these different civilizations are, but having the same mindset of total body healing. Well, guys, I hope you found today's video interesting, and I am so thankful that you were here to watch. Remember to like, share, and subscribe, and I'll see you soon.